All right, welcome everybody. I'm John Guthrie, the Vice President of Communications at Halifax Health. And we are really glad to be here because when we tried to do this on Wednesday, AT&T was having an outage. And lo and behold, we just couldn't get this done. And there has been so many notes, emails, phone calls about how can I see Dr. Ahmed, what happened. Turns out you didn't miss a thing because we are going to have a great conversation. I'm joined by Dr. Salman Ahmed. He is a pediatrician for Children's Medical Center, which is Halifax Health's pediatrics offices. He also served, and we thank him for his volunteering, on the committee that helped to decide protocols and times to reopen schools for Volusia County. And today we are going to hit questions hard on what it means to open schools up, to have children and teachers in those schools, and what it means to the community now that we have COVID-19. So welcome, Dr. Ahmed, and thanks for being here.
Thank you, John, for your kind introduction and invitation. We would love to talk about the issues that are being faced with right now, especially reopening of schools and how we can do that safely.
And there's a lot that's happened. I mean, since this has happened, and I read the news today, which is just terrible, we've had 8 children in Florida who have succumbed to COVID-19. What have we seen locally at our practices, and what have you seen and your colleagues seen locally?
So in terms of what in Volusia County has had about 9,000 cases of COVID-19 infection. Our population is over 500,000, so that equates to about 1.5%, which is a relatively low number if you look at what we are seeing in the rest of the state, like places like Miami-Dade County, where the numbers are as high as 5 to 6% of the population has confirmed COVID-19. We have had about 500 cases of children infected with COVID-19, and we've had about fortunately, we have not had anyone with an MIS-C complication, or we have not lost any kid in our community.
And you just dropped out MIS, which stands for?
Multi-system inflammatory syndrome in children. And this is what you worry the most about. All over the United States, from what we have learned so far, there have been about 500 reported cases. There have been about 90 deaths in the United States. So we've lost 90 children to COVID-related complications, which is very unfortunate.
And as we were talking before, comorbidities seem to be the driver of the severity
That's right.
of COVID-19 and COVID-19 related symptoms.
So about of all the reported cases, I think 55% are reported in blacks and Hispanics. In terms of other comorbidities, we have children who are obese, we have children who have diabetes, we have children who have underlying severe lung disease, and then also we've seen it in cases where they've never had any pre-existing conditions. So it's just so unpredictable.
And before we went on the air, Dr. Ahmed said the one thing we know is we have to respect the coronavirus, and that's so true because there is so much that we don't know. But one thing I want to pull from the piece that you just gave us is, we've always said, your children should play, your children should eat right, you should take care of your health. And it used to be that you might say, well, yeah, I don't want to be obese, or, yeah, I should drink water instead of soda, but I don't really see the long-term ramifications necessarily. But when we have a pandemic like this, it's very clear that the more healthy you are.
Yeah. So it's a good time to revisit our lifestyle and our eating habits, and just like you said. Now, when we talk about these children who've had a higher incidence of COVID-19, there are other factors contributing to that as well. They may represent lower socioeconomic conditions. They may live in families, what we call multi-generational households.
Right.
They may have limited access to health care. They may not seek health care at the right time. So still we don't have a very good understanding. And we also are still in the early stages of learning about this virus, where we have a lot to learn in terms of who's susceptible, who does okay, and
let's talk about this. Dr. Ahmed and I were talking before we started the broadcast. There's a thing called a viral load, and what I've been reading lately, and if you could comment on it, is children have a higher viral load often, not always, than adults. What does that mean?
So if you look at the total number of cases in the world, children represent about 2% of all the global cases. What that tells us is that they contract the virus at a much lower rate than adults, and the impression in the beginning was that maybe the amount of virus they have in their nasal passages or respiratory passages is not as high, but recent studies, that the two articles that we were talking about earlier, have shown that that is not the case. Children do carry a very high viral load. Viral load means the amount of virus that one has at a given time. So you need a more sophisticated test to analyze that. The test that we have, the PCR test, is what we call a qualitative test. It just gives us a report as someone has a virus or not, but there's a more sophisticated test, a quantitative analysis, where you can differentiate how much virus does one have or the other.
And why, as we open up schools and become more active, why is viral load important to think about? We may not be able to measure it, but it's something that we can have in our minds to say, children can carry a higher viral load. What does that mean to me as a father or a grandfather or a grandmother?
So a common sense would dictate that a higher viral load would make you more infectious or more contagious. Now, like we talked about, the rate at which children acquire the infection is very, very low. In terms of being asymptomatic, children tend to be more asymptomatic. What we don't know is how contagious they are, how infectious they are. Of all the literature that, if you look at, all the super spreaders have been adults. There have not been any cases where, an outbreak has been associated with kids causing adults to get sick.
Of course, kids have been, I feel, more in the I was going to use the word furlough, but that's not right for kids. They've been more locked down.
That's right.
Than adults.
Yes.
So we haven't seen a child boat party. We've only seen an adult boat party. So we're going to have to find out what that level is. But we may, in fact, and I don't want to cause alarm, but we may see a small spike if, and this is the if those children are asymptomatic, but they have a viral load, one of the most important things we can do is keep them safely away or very carefully with a susceptible person, thinking of someone who's older.
So that's a big question right now, is what will happen. Our numbers as a county, we have done relatively well compared to the rest of the state, but we don't know what reopening of schools will do to our county. Are we going to see an uptick? And if we do see a significant uptick, the only explanation would be reopening of schools, and maybe children are contributing to the spread of the virus.
Right.
So it's something that we just have to wait and see. Going forward, we have two good things. We have we have a rate which is much lower. The other thing is the enrollment for on-site schooling has dropped significantly.
True. 62% of those
62%
who filled out the form. So that is a great point.
So that is making our schools less crowded, and I think it's helping everyone. So we do acknowledge all the parents who have made the decision and who are sacrificing keeping their kids at home, that they are contributing to limiting the spread of infection.
That's true. And we've always said that when Dr. Crossman was on, people need to know their child and their family to understand what decisions they make. Right. And I think most people have probably made their decisions now, but one thing that I've seen with a lot of my friends is they may be keeping their children at home simply because they're not worried about it. They're not worried about for their children, but they have a relationship with a grandparent and they don't want to risk that relationship.
Yeah, you're absolutely right. We made a decision, just like all the parents, we struggled with it as well, and we finally made a decision that we are sending our kids back to school. My daughter is would be going into third grade, my son in sixth grade, and we don't have anyone at home who can watch them be in front of the computer all day. Right. So I do hope, and we truly believe that Our teachers are very dedicated, they are committed, and they'll do their best to mitigate the spread of the virus.
Yeah, I think everybody's committed, and I think the other thing is people are getting used to social distancing
That's
and
right.
masks and hand hygiene. At the beginning, I think we were teaching ourselves a new behavior, but now with some of the mandates and those things, I think we're getting better and better at it. And children sometimes can be better than adults because they get ingrained in things like seatbelts and things
That's
like
right.
that much easier.
John, I see children in the office as young as 2 years of age, and they are wearing these cute masks, and they have absolutely no problem
Right.
at all.
Right.
And they're reluctant to even take their mask off.
So let's talk about that for a second, because as schools open, I've been hearing from officials there that students will wear masks. My
That's right.
first question to you is, I've noticed two things about masks anecdotally. One is you don't know if someone's smiling. You don't know what their mood is. And that, I think, does play into interpersonal communication. But then I've also heard something called mask face or mask face or something, where the breathing out into the mask, you're not getting as much stuff in to clean your saliva and all this kind of stuff. Is any of this legit?
There's no science to that. Studies have shown that masks can be safely worn by almost everyone, except someone who's incapacitated, who's unable to, protect their airways, and even children as young as 2-3 years of age, they can wear masks
Excellent.
without.
So let's put the mask face thing
And
to
while
bed.
we are talking about masks, there was a study that came out from California, and they found out that mask does several things. It protects the mask wearer, it protects others, and if you do get exposed to the virus while you're wearing mask, the viral load that you're subjected to is not as high as if you were not wearing a mask.
That's good.
And the thinking is our immune system can better cope with a lower viral load than be all of a sudden subjected to a higher viral load.
So that's a good thing. I mean, everything indicates. I know it was confusing in the very beginning because when they first came out, they said, you don't need to wear masks. But I think a lot of that was they were protecting the supply, and they didn't want to have a run on masks. And now it seems like the supply, and to your point, the entrepreneurs and the artists and everybody's getting involved in this thing, and it's a good thing. Now let me ask you this though. I've seen people say, and I've been to stores where someone says, well, I don't wear a mask, I wear a shield, that plastic thing that goes like that. And me not being a medical person just says, okay, so whatever's coming out of you is going like this now.
That's right.
So talk about the whole shield and what your thoughts are there, if you would.
So if you look at the shields are not considered very protective for the same reason, like you explained, that it's not blocking the respiratory droplets. There was a study that was done by a physics department at Duke University. They looked at different mask options, and they found out that the N95, the fitted mask, is the best mask. Cloth masks are also very effective. They don't like the bandanas, they don't like the scarf mask, and they don't like the gaiter mask.
Right.
Now, I had a mom in the office earlier last week, and she's a speech therapist, and she said she ordered masks for her students because they have to watch her move her lips, and so in a situation like that, absolutely the face shields would be the best way to go.
Yeah, I guess you have to look at it, and again, just like you have to say, what is your family makeup, what is the child like, you have to say, what is the situation? But overall, I'm going to put you on the spot here and say that mask wearing is more effective than shield wearing.
Absolutely.
Okay.
The single most effective thing we can do to limit the spread of virus, and I think the single most effective thing we can do to bring our lives back to normal is wear masks.
Yeah, I agree. Also, if there are questions out there, I know I'm asking a lot of questions, but if there are questions, feel free to send them in and we'll check and we'll be able to ask specific questions of Dr. Ahmed, who we're so pleased to have here today. Let's talk about infection rate, or what they call the R0. What is the R0?
So R0 is a measure of how contagious the virus is. With influenza, we have an R0 of about 1 to 2 or 1 to 1.5. What that means is if a person has influenza, he's more likely to infect the virus to another person or a person and a half. With COVID-19, the R naught is about 2 to 3. And to have a better perspective, the virus that we worry the most about, or it's been known to be one of the most contagious virus to mankind, is measles and also chickenpox. Measles has an R naught of about 12 to 18.
Wow.
12 to 18. Like if one person has measles, they can spread the virus to about 12 to 18 other individuals.
So
No, it's not just like causing the virus. It's not just causing the infection to spread to 2 other individuals. It's just like if you factor in exponential growth,
right.
all of a sudden you have. So a desired R naught is about 1 if you are dealing with an epidemic. If you have an R naught of 1, so it's easier to control an infection and limit its spread if you have a R naught of 1.
A couple questions coming in, then I want to get back to vaccines to talk about that with R naughts. But they said, have you had many positive patients? Have we had many here?
So in our practice, I don't know the exact number. I think collectively I would say about 15 to 20 positive cases. Most of the children that we have taken care of, myself directly or indirectly, we've done telehealth visits. By the time we get the results back, they're doing fine. My youngest patients were 3-month-old twins. And
wow.
They were diagnosed 2 weeks ago. I just spoke to their mom this morning and she said they were doing fine. So one of the twin had to be hospitalized overnight because he was having some respiratory distress, but they're doing fine.
That's great. So we've been relatively
Done well.
fortunate. You know, I mean, I don't want anybody to have to deal with it, and it seems like that we're not seeing overly serious complications with it. But as you mentioned before, this is the time to be extremely careful. And there's a question up here that says, if you have grandparents, and we love our grandparents,
Yes.
What activities would be okay? And I don't know if they've loosened up visitation at nursing homes yet or not, but that might be a good guide. What do you think?
I would wait until we are a few weeks into the school and into the reopening of schools and see how everything plays out.
Okay.
If we are seeing a significant uptake, then I would be very careful.
Let me ask you this, though. I know I have a friend who has a father in the nursing home. And what they have been able to do is open the door to the outside patio. He sits inside with a mask. She sits outside about 8 feet away with a mask. What are your feelings on that kind of, they're not touching each other, they're not the 6 feet for 15 minutes, they're both masked.
Yeah.
I mean, do you think that's acceptable?
To an extent, I'm sure it's not full protection, but it's better than like being face to face and
Right.
and more intimate contact.
So you have to take care of mask, hand hygiene, social distancing, and but I think it's wise until we see what happens
That's right.
to not run that risk, kind of. There's another question up here that's about sports. Sports is, I'm just thinking about baseball. Everybody touches that baseball, but that's outside. But they're in the dugout. You know what I mean? Can kids play sports?
So my son took a tennis camp. He was part of the tennis camp during summer months, and they were not allowed to touch the balls for the same reason. They could, it's a perfect setup where all you do is get to hit the ball.
Yeah, you don't have to pick them up.
You don't have to pick them up.
That's awesome.
But team sports where you share things and you are in more intimate contact, I think are probably not advisable.
Gotcha. And the other thing I was thinking about is, the school bus.
Yes.
For kids who ride the school bus, you can space out, but tough.
Yes.
Any thoughts there?
So it's like what they emphasize is good ventilation.
Yeah.
If the school bus, they have their windows open and they can get some fresh air, that would be a good answer.
Gotcha. That makes sense. So that kind of answers that. I think people have to choose again on what they want to do from a sports side, but if it can be non-contact.
Yes.
And I've heard people say, how is band going to happen and how are these other things? And we just have to trust that the school's going to do what's best for the community.
Yeah.
And I think they will, and they have. Is there anything children can take every day before going to school to help them fight off getting the virus?
Of course, good nutrition.
Yep.
Vitamin D has been talked about.
Right?
Vitamin D, zinc, vitamin C.
So a good multivitamin would not...
Would not be a bad idea,
Yeah.
especially if you know someone who doesn't eat healthy, who's a very picky eater. Yes.
All right, now this is right up the doctor's alley. Is there anything natural that we can help build the immune system for children? We were just talking about this earlier. Where would you recommend to go to research that, where you get good research on a natural substance to build the immune system?
Yeah, I think it's up to the viewers and see what they can learn. I mean, I personally have been using black seeds. I recommend that. A lot of families use black seed, and there is enough evidence that they do have a protective. They are very beneficial. There was an article that just came out from Germany where they looked at black seeds and they said maybe this may be an answer to deal with this pandemic.
And you know, I think you're right. You need to go to people and publications that are trusted with, I believe, evidence-based.
Evidence-based or peer-reviewed.
Yeah. And see. But there are things out there that people can use for that. So we were on the term of vaccines. Now, obviously, we're going to start the flu vaccine soon.
Yes.
Can you talk about influenza, the flu, coronavirus, and the flu vaccine, and how that all fits together?
So that's one of our biggest concerns right now as we go into fall and winter season, where we get overwhelmed with influenza, we get overwhelmed with respiratory viruses. How are we going to differentiate one or the other? Now, if you look at influenza causes about 60 to 100,000 deaths every year. We lose about 100 children to influenza every year, and as of now, half of United States population gets flu vaccine. All the experts are recommending that this year is more important than ever to get flu vaccine. So I would strongly encourage. I will have my children vaccinated. We as healthcare workers, we always get the flu vaccine. Right. So that's important. And
you know, the interesting thing you bring up though is we haven't seen what the flu and someone with coronavirus at the same time. Yes. We don't know what that could do.
Yeah, so John, there is a phenomena which we call co-infection. Co-infection is like if you get sick with more than one pathogen at a given time. This happens all the time in younger children in a daycare setting, where they may not just have a respiratory virus, but they also have a bacterial pathogen, and these children tend to get more sick than others. We also know that younger children, daycare kids, and schools, it's a very, very conducive environment to spread of these respiratory viruses. Now, what would COVID-19 do in a combination or in a combination with these other viruses or other bacterial pathogens? We just have to wait and see.
And that's the tricky part, because what we've found here at Halifax Health, and I think you found in your practice, is that comorbidities are kind of the swing point on how serious the symptoms and how the outcome will be.
Yes.
And so, you know, is the influenza a comorbidity that's going to impact that? We'll have to see.
Yeah.
So what happens? My child has sniffles, has sore throat, fever, and now what do I do now that COVID lives in our world and we also have influenza?
So you call the doctor's office, and the first thing they'll tell you is, we don't want you to come to the office, because unless and until you've been tested for COVID-19.
Because they're worried about spreading it?
They're worried about bringing the virus into their offices and spreading it to the office staff. Now, this is what worries me the most, and I have made several suggestions, and hopefully what I'm proposing is that we have an independent site where all the children who are sick, they can go for a rapid test, where we can screen for influenza, we can screen for COVID, we can screen for RSV, which is a very common pathogen at this time of the year. See, up till now, we've done a lot of telehealth visits now, but when you're dealing with someone who has breathing issues or who has a hard time breathing, you cannot do a telehealth visit. You have to put your stethoscope and listen to them.
Yeah.
And that's why it's important. Now, if we start sending this message out that you are sick, you have fever, you cannot come into a doctor's office, if you start sending them to the ER or urgent cares, they will get overwhelmed, and that's not good practice. So I'm hoping that over the next few weeks, the hospital will provide us a solution where we can have an independent setup where these children who are sick, they can go there first, get screened, and if they come back negative for COVID-19, then they can go and see the doctor.
And that's a great point, because what we did for the emergency department, and this was largely for people who had COVID symptoms but were so sick that they needed hospital care. We set up a special isolation unit in the emergency department, and then if they had to get admitted, another special isolation unit. What we would most likely see are children who don't need hospital care,
Yes,
but need a diagnosis
that's right.
to handle what.
Yeah.
Okay, so let's say the child has COVID-19, but it's a basic flu level thing. What would you most likely, I'm not saying always, but what would you most likely prescribe for them? Or is there anything to do, or you just wait it out?
Perhaps nothing. If they have an underlying breathing issues and if they use nebulizer or inhalers, we will ask the parents to use a nebulizer or inhaler. In terms of antibiotic, we do not prescribe antibiotic, just supportive care, good nutrition, hydration.
And so, if a child has influenza, do they get a pharmaceutical?
Yes, so if you see them within 48 hours of getting sick, you can prescribe a anti-flu medicine.
Interesting. And that reduces the amount of time they have flu, correct?
That's right. That can cut down the symptoms and helps them recover more quickly.
But COVID doesn't have that.
COVID, we don't have a proper treatment right now. There are treatments for patients who are hospitalized, but for children, we don't have anything other than just supportive care right now.
Unless, I suppose, if they got hospitalized, then they would be on the hospital regimen.
That's right, and we were reading about hospitalization studies. From what we have known so far, about 1/3 of children who get hospitalized, they end up being in the intensive care unit. So when they do get hospitalized, they do get quite sick.
Yeah.
And they have to be properly observed.
Very different ends of the spectrum.
Yes.
Interesting. So the message is vaccinations. If you, I guess you would say vaccinations for the flu are important.
Absolutely.
Because though it isn't going to stop COVID,
Yeah.
it may make it less impactful.
That's right, and if we get a call from a parent that our child is sick, and if we know that they've had the flu vaccine, so we would have more reason to suspect COVID-19 than flu. The other thing, John, what's important is parents don't realize that of all the individuals who die from influenza, 2/3 of them have not had the vaccine. Even though the vaccine doesn't give you complete protection, but we do know that it does reduce the mortality. So
Right.
2/3 of individuals who die from flu, they've not had the vaccine, compared to 1/3 who've had the
Wow.
vaccine and still succumb to the.
So the science is still there
Absolutely.
for vaccines.
Absolutely.
That's good to know. There's a question here that kind of makes me laugh, because this is a real life question. If your child has to be restrained to have a PCR test, which is essentially a swab in the nasopharynx.
Nasopharynx, yes.
If you have to do that, this one says certain urgent cares wouldn't restrain the child. In other words, I think they might have been afraid to touch the child. So what would you do? And this one says, can the parent hold the child? And I've held my child through many different things. So what is your take on that?
How big is this child?
I don't know, but let's just
Yeah,
say,
younger children, moms can hold them in their lap. I tell them to put one arm around them, one arm over their forehead, and then restrain them. And while you swab them, you can also hold them down. You can also ask the nursing staff to assist you.
So we'll get it
done. The swab
done.
itself is done within seconds.
Yeah, it's a quick thing. It's just a little deeper than we're used to, right?
Yeah, and if you have someone who has a runny nose, who clearly has all that snot in their nose, you don't have to go too far.
You can find it. So there's your answer on that. We will help you, or the parent can restrain the child, because it's a scary thing.
It is.
They've heard it on the news, and then somebody's coming at you with a swab, and if they're young, I can understand that totally.
And John, the swabs come in two different sizes. So
that's
there
good.
is a swab which is a very thin swab, which is more tolerated by children. Normally, the kids have a thicker swab, so I would recommend make sure that the person using the swab is using the right swab.
Now, when you were working with the school district, advising them, will they be doing testing, do you think? Is that in their protocol at all?
So that's the biggest hurdle right now, or I would say our shortcoming. We don't have a proper surveillance system.
Okay.
So if you look at what countries like France and Germany did when they reopened their school, their system was a bit more sophisticated, where children were randomly screened. You know, they were testing them on Thursday, Friday, notifying them over the weekend that don't bring your child over. So they were successful. Unfortunately, we don't have that system in our county, and not in our, the testing capability is so limited. And if the ones who do test positive, the contact tracing is not in place. So the health department stopped contact tracing months ago because they said we don't have the resources.
So so let's talk about that for a second, because you mentioned, was it Israel where 240 schools?
They had to close down
240
schools.
So if, in our protocol here, if someone gets symptoms, test positive, luckily we have distance learning, so the child can still do distance learning.
Absolutely.
Will that child have to report, or that family report to the school that, yes, my child was COVID-19 positive and he or she's going to be out
Absolutely.
for 14 days?
So as parents, in the past, we've all been guilty of sending our sick kids to school, but this year is very important. We have to make sure if our children are sick, they need to stay away from school. Absolutely. And
so that's something that we need to really pay attention
if they
to.
do test positive for COVID-19, the authorities should be notified.
And then quarantine. Yeah. And I've been thinking about the contact tracing, because you're right. The United States doesn't have a robust contact tracing. So I still live my day out. Now, most of it is spent with my colleagues here or at home, but I was thinking it's kind of important to know where you and your kids have been, so that, I'm not saying necessarily keep a journal, but take note of where you've been, because I've been to a couple places where I've gotten an email which says, on August 3rd,
yes,
a person here contracted or was diagnosed with COVID-19, and then I have to go back and think, okay, August 3rd, where was I? So I think it is important to pay a little bit more attention to your surroundings.
I did a telehealth visit 2 weeks ago. This teenager, she volunteered with her family at a meal processing facility, and they were notified that someone was positive, so they called the office. This girl had cold symptoms. I met her outside in the parking lot. I did a swab on her, and 2 days later we got the results back.
Yeah. And so,
while we're talking about the test, one thing that we're missing right now is a quick turnaround time.
Right.
PCR tests, they're taking several days, and you don't always have the luxury. Sometimes a parent has to go back to work, or they don't want to wait for the results. And that's why rapid antigen tests would fill in that void.
Yep.
But the problem with rapid antigen tests is they're not as reliable as a PCR test.
That's the most reliable?
PCR is the most reliable.
And the PCR test for coronavirus and influenza, or not?
So right now the PCR tests check for coronavirus. Now some labs, they can do this test for flu from the same swab.
Gotcha.
Or they may have to have an extra swab.
Because that would be ideal.
That's right.
If we could do that.
Yeah.
Here's a question. Do you advise kids with heart defects who have had multiple heart surgeries to be homeschooled until a vaccine is available? I read MIS attacks major organs like the heart. What do you say to that one?
I would recommend this particular child, if they have a severe congenital heart disease with major surgeries, not to take a chance and stay home.
Yeah, and I think again, you have to look. I mean, luckily we have 3 choices: bricks and mortar, which you brought up a great point. Of the 62% who are going, that's going to mean that, well, the 62% who responded who are going, that means we want to have as many kids in the classes.
That's right.
And then we have online, this, where the teacher's there, and then we have the virtual.
The virtual.
So
yes.
there are a lot of choices, and we're lucky for that. So you know, as we think about going back into school, I think about the kids' clothes, their books, their water bottles. I want to take the kid and, you know, throw him in the pool with his clothes and his books and disinfect him and then bring him in the house. But obviously that's not totally practical. Do we need to, you know, keep our shoes outside and put our clothes directly in the washer and all these things? Or where are we?
Yeah, we don't have to go overboard. Just like we talked about, hand hygiene, face mask, frequent washing, and I think in between the classes have their tables sanitized.
Yeah.
And teachers would be overseeing some of that.
So clothes and
Yeah.
books and water bottles don't.
Yeah.
You're not too worried.
You know, so some authorities have recommended kids bring their own meals instead
Yeah.
of standing in line and
True.
sharing and so forth. But
All right, let's see. I have a couple other things. This is kind of an interesting one. I read it that Yale and NBA came up with a test that you could do with saliva for $10.
yes,
What do you think of the potential for that?
great.
Yeah?
Great, yeah. It's a non-proprietary technology, and it can be easily mass-produced, and provided the test is very sensitive. Earlier we were talking about what does sensitivity and what does specificity.
Right.
So if the test is reliable, it's cheap, the results are quickly available, why not? Absolutely.
And so, like, how long do you think, how long do you think it's going to be before, this is kind of a 2-page question here, before we're dealing with testing people and watching out for it and all those things? I mean, are we going to be in a society where when you get a cold, you're going to have to go and do a spit cup test for a long time? Or is that going to go away? And then the next question you can tag onto that is, I know we've heard from politicians and various people when they think a vaccine will be ready, but there's a lot of testing that goes into all that. Will that be something that, how will we know when it's the right time to really recommend that?
The vaccine.
Yeah.
So as of now, there are 169 studies or work being done on different on the vaccines by different manufacturers all over the world. So hopefully we will have an effective vaccine. FDA has set the bar at about 50%. They want the vaccine to be at least 50% effective, which is quite low, but I'm sure between what is being done in Europe and United States, we will have a vaccine that would be superior and
that would 50%.
That would be superior to not just 50%, would be more effective
Better.
in protecting half of the individuals.
So when the FDA says yes, we have a vaccine that meets our approval, would you take it?
I would. Yeah.
Yeah? So that's really what we're looking for.
Yeah.
When the FDA says we have a vaccine,
Yeah.
that's when we should all jump in, knowing that it's going to change and it's going to get better and better.
Yeah, John, we don't, in the foreseeable future, we don't see things changing. The virus is not going anywhere. It probably will be around until year 2021, until we have some degree of protection. In terms of herd immunity, as of now, we feel like maybe 10% of the population may have it. You have to have 70% of the population to have protective antibodies or herd immunity to limit the spread. So that's not going to happen naturally. So we still have to have all these mitigating measures in place until we get to that point. And we have to protect the vulnerable, the more susceptible.
And like the flu, if I'm not mistaken, when people develop the flu vaccine, they guess on what the flu strain will be for that year.
Yeah.
And some years they do better than others. When we get a coronavirus, COVID SARS-2, will that be a guessing game a little bit over time, or it
would be specific to the virus.
Oh, that's good.
Unless the virus mutates, which is less likely, but it would have that protection.
So I'm talking with Dr. Salman Ahmed. He is our Halifax Health Children's Medical Center pediatrician, and also, I didn't mention this earlier, he is an infectious disease physician as well. So it's kind of a double whammy. We're going to get ready to go off air here, but I want to just send one opportunity out there, because we've had a lot of really good questions. I'd like to see if there are any other questions before we close out. And the great thing about Facebook Live is this will exist. Last time you were on here, we got over 15,000?
20.
Over 20,000 views. So share this with people, because I think it's important that you hear from someone that A, you trust, B, is in our community, and C, is willing to spend his time and expertise with us on a Friday afternoon to share these thoughts with you. And we will definitely have him back as we move forward. But what we tried to do today was hit on as many issues as we can about children. And what I come away with it is vaccine is very important. We need to look at the children for their own, possibility of contracting COVID-19.
That's right.
But secondarily, and perhaps more important, is that we don't want them to spread it to vulnerable populations. So those are kind of the big overlying things that that we kind of see here, and you're getting lots of thanks. Dr. Ahmed, you are a pillar in our community, and we really, really appreciate